Hi everyone, I'm Dr. Nishi Jayasheelan, a reader from Department of Conservative Dentistry and Endodontics from Yenepoya Dental College, and I'm here to talk on the topic shade selection. The specific learning objectives that's going to be covered under this presentation is understanding what is color, to understand what is the importance of shade selection, to know how to select the correct shade and how to communicate with the lab, and to know what are the recent advances in the shade selection. So all of us are familiar with colors and all of us love colors. For us, colors is what brings out the beauty in nature. Whenever something is very colorful, we get attracted to it. But at the same time, you remove color from the elements, it becomes very dull. We kind of go into a very dull mode. We are not very happy about it, and that's how things go on. So what do you think a blind person sees? So most of us guesses would be it would be a dark image, but no, they do see colors. They are just going to see some spots of lights within their vision. So no, blind people do not see just the black background. So how is it effective for us to apply in dentistry? Well, if you don't do a correct shade selection, you can never match the aesthetics of a natural tooth. You cannot bring the natural beauty of a tooth out until and unless you get the shade selection properly and you do a good aesthetic work. So let's move on to the topic of shade selection. So before we start, let us understand what are colors. So most of us know that colors come in different textures, different shades and different intensities of colors. So there is like turquoise blue, there is peacock green, so many colors are there, right? So when it comes to the tooth also, there are different shades that we need to know. So first let us understand what is color. How do we see these different shades of color? So whenever a white light passes through a prism, it differentiates into multiple colors. So whatever shade gets absorbed by us, by our vision, is when what gets reflected out is what we see, and that's how we perceive color. So let's understand the basics of how color is identified. So we know it is hue chroma value, so let's have a closer look at that. So what is basically hue? Hue is nothing but the actual color of an object. So here if you can see, it is red, yellow, orange and green. So that is hue, the actual color of an object. What is chroma? Chroma is nothing but the intensity of that hue. That is the different variations that you can see in your color selections. What is value? Value is nothing but the intensity of the color. Is it darker or is it lighter? So that's what makes the tooth look brighter or duller. Okay. So that's the value. So now once we have understood what is hue, chroma and value, let's understand how do we apply it when it comes to a natural tooth. So when it comes to natural tooth, we know that there is dentin and enamel which is responsible for how we perceive the color of the tooth. So we know that in the cervical portion, the dentin is the thickest and the enamel is thinnest. Now enamel, because of its structure, it's like a faded glass. So it just lets a little bit of light to pass through. So in the cervical area, because the enamel thickness is less, what you're going to see or perceive is the shade of the dentin, because the thickness of dentin is more. So the light that's getting reflected back or bounced back is the chroma from the dentin. When you come to the middle of the tooth, almost there is equal thickness of dentin and enamel. So what you're going to perceive is a mix, a blend of both the colors. So the intensity of the color reduces as you come towards the middle third. When you come towards the incisal, the thickness of enamel is the highest. So it is going to allow all of the light or some of the light to pass through depending on the thickness and the calcification of enamel. Now, at the edge, you can see in most younger patients, you would see something called as an incisal halo. So, the border of the enamel is thicker or more opaque and the layer between is a little bit more translucent. So, that is what creates an incisal halo. So, you need to know that these are the different shades that you're going to see when you're seeing a tooth. So, let's see. If according to you, do you think both of these objects are of the same color? Let's see. If we change the light source, what happens? So when we change the light source, you can see the same objects are not same anymore. You can see one of the color is darker than the other. This is called as metamerism. So you need to know that most of the tooth will have this property also. So it's important when you're doing your restorations that you check it under different light sources so that they don't appear different under different light sources. So this is a metameric break. So you can see how a crown under different light sources, it is still resembling same. This is what you need to achieve when it comes to aesthetics. Another property that we should be familiar with is fluorescence. Fluorescence is one of the properties of the tooth wherein when you apply a light, you can see a crack line, or it allows only little bit of the light to pass through the tooth. So this is most commonly used to identify if there are any cracks within the tooth. But you can see how the shade also appears a lot different. The next property that you should know is opalescence. In this, enamel is more translucent and more crystalline than dentin. So you can see how the enamel opalescence can be mimicked by porcelain. This is what I was talking about earlier. You can see here the edge of the incisal edge is more opaque. There is a translucency between that, and then the shade is getting intense more. Now this is the incisal halo, and this is most commonly seen in younger patients, and it varies in depth and depending on the vitality of the tooth. It is very important that you have to replicate this in your final restoration if your patient is having these kind of textures. So now let's move on to shade selection. So most commonly, if most of the ladies would know this, that when we go out for shade selection, we kind of always pan the different shades in front of our face. The same thing comes to shade selection also. You need to know where different colors are to be placed, what all tints has to be added, and how to recreate the shade of the tooth to match it to perfection. So this involves three main things. One is the light source, the object, and the detector. Now coming to step 1, manufacturers has arranged the tabs according to the hue. Now we can rearrange the shade based on the value, so it becomes easier for us to appreciate it or perceive it. Now in this shade selection, it will be, the shade arrangement would be of the highest value and the lowest chroma. Step 2. Most of the patients would come up with a heavy makeup or a bright colored dress. So it's important that you ask the patient to remove any kind of lipsticks or dark lipsticks they are wearing, and you can cover up any bright coloring with a drape, a neutral drape. Moving on to step 3. You have to ask the patient to go for a prophylaxis first and remove all the stains from the teeth. Step 4 is always raise the patient's chair height at your eye level. Step 5 is you stand at a 5-meter distance from the patient. Step 6 is you turn off the artificial light and you make the shade selection under the natural light. That is step 7. Now step 8 is you take the shade tab and pan it across the patient's tooth of interest and you squint your eyes. What happens is when you squint your eyes, the rods are in use and you can perceive more of color. That was step 10. Now in step 11, what happens is if you're looking too hard and you're trying to make a shade selection and it's not happening, it is important that you rest your eyes to a neutral color. You have to let your eyes relax and then you go back to your shade selection to avoid making any kind of errors. Step 12, now since you have decided among 2 shades and now your final decision has to be done. So just span those 2 shades in front of the tooth of interest and make a selection within 5 seconds again. So that would be a step 12. Step 13, understand that the tooth is polychromatic. So there's going to be different shades. So as I showed earlier, you have to select a shade from the cervical, a middle and an incisal 1/3. So this is how you're going to make a shade selection. So each shade is going to be different. Again, once you do this, this is your polychromatic shade selection done. Step 13.5 is that involve the patient. Show the patient this is the shade that you have selected and this is what is going to be your final prosthesis color. So once the patient is happy, your steps are done. So this was the basic steps of shade selection that you need to follow. So as I said, dentin and enamel has different roles to play when it comes to showing us the color. Now, dentin gives the tooth the color, the opacity, the lobes, the fluorescence, and it has a higher chroma and a higher value. Enamel, on the other hand, gives the shape to the tooth, it gives the surface textures, it modifies the dentin color. That is why you get a polychromatic color. It reduces the chroma and the value. So when you see in older patients, enamel would have been worn off, so you get more or less like a monochromatic color. This is because of age changes. Now, dentin shade is obtained from the gingival third because, as I said earlier, the chroma is the greatest in the cervical 1/3 because the thickness of dentin is more in the cervical 1/3 and the thickness of enamel is least in the cervical 1/3. So, enamel shade should be selected from the middle third or the incisal 1/3. It is important that you understand that there is a depth of color in your restoration that you need to recreate to match the natural aesthetics of the tooth. So, always what we do is we use a Vita shades guide, or what happens is those are designed for porcelain or ceramic crowns. But our composites have different shades based on the manufacturer. So, it is always advisable that you make your own shade tabs which will match according to the composite that you are using. Now we have understood what are the different shade colors, what are the different areas that we need to isolate and recreate, but how do we decide what color or what tints has to be added and at what depth? So, dentin color will be always towards the cervical 1/3, or the bulkiest portion will be from the cervical 1/3 to the incisal. So, you can see a faint line which is thickest in the cervical, but as it is going towards the incisal, it is tapering down. This is the same procedure that you should follow when you are doing a composite restoration or a ceramic layering. So, the dentin thickness or the depth of the color will start varying and thinning out as it reaches the enamel shade. But on the contrary, if you see the enamel colors, it is thinnest when it comes to the cervical 1/3, and as it reaches the incisal 1/3, the color is more deeper or the thickness is more. So, this is what gives the polychromatic effects. Now, the dentin effects are more or less which you should add between these two layers. If you do not add it, they cannot be appreciated in your final restoration. And final surface effects or your surface textures are given on after your final enamel layering is done. This is how you are supposed to send a communication to a lab. So, you draw a diagram or an outline of a tooth, and then you have to do markings on what all shades are there, what all extra features that you are intending on adding, and then you take a photograph and send it along with your shade drawing to the lab so that they can replicate the same thing. So, another thing that you should know is when it comes to shade selection is photography. You need to be able to accurately document your colors and then translate them to the lab. Now, here you can see that keeping a black contraster onto as a background, you can see how the incisal architecture is very much easy to appreciate comparative to the one without a contraster. Here also you can see the incisal edge, translucencies, any kind of mamelons which has to be created and if you place a contraster. Always take a very clear picture wherein you can see the shades of all the teeth. Documentation is really important. Now, another thing that most of us don't notice is that when we ask the patient to keep their mouth open and you take a photo, and you can see the difference. You can see the black background highlighting the incisal translucency and the white opacities in the incisal edge. You can see the surface textures more clearly when the tooth is in a little open position, whereas compared to the closed one. The incisal side of a tooth gives you an idea on what should be the thickness of the enamel and how much from where the dentin layering should begin. Always make it a point that you take a photo along with the shade tab that you have selected so that it is easy for them to have an idea on what was your shade selection and gradation. Next thing that you can do is you can make various effects can be applied on your photograph so that it is easier to map it. So here you can see the contrast has been changed, so it's much more easier to tell what is the depth of the dentin, where how much thickness it has to be layered, and what are the enamel patterns you're supposed to be placing. If any mamelons has to be placed, all these can be much appreciated if you change the intensity of the color. Another technique is by placing composite buttons. So you have a doubt regarding what chroma it is or what value it is, you place different composite shade buttons on the tooth and then you hyper contrast the image or you make it a negative image. So in that, if you make it a negative image, you get the value. If you make a hyper contrast photo, you get more of the chroma. Another tool which is very helpful for shade selection is the Vita EC shade guide. Now Vita EC shade guide can be just placed on the patient's tooth and it will give you a reading on what is the shade of the patient. So to conclude, it is important that you evaluate and select the accurate shade of a tooth and to deliver a perfect restoration to the patient. This can be achieved only if you understand what are the fundamental concepts of color matching and how you can and where you are supposed to place each different shade and at what depth. Once you are clear with this, it becomes very easy for you to make a shade selection and achieve the best of aesthetics that's possible. So understand that there are a lot of shades, there are a lot of tints which is available, which like how you do in a painting, you can mix and match and recreate the color of the tooth. Always know at what depth and where you have to place which shade, otherwise it will be too much or too less. Don't define your world within black and white because there is always a lot hiding among the grays. So these are my references. Thank you. Have a great day.